I'm Dr. Mukherjee. I'm a specialist in kidney diseases. What we cover is dialysis, kidney transplant, kidney cancers, prostate, stone diseases, urinary tract infection, in fact, the entire gamut of kidney and the entire genitourinary system. I'm very happy to be here in Itanagar in Arunachal Pradesh.
Heart and kidney health are closely connected. So, could you explain how once our tribal people peer dialysis? So, could you clarify its role and when it becomes necessary for public information?
See, dialysis is, you're very right. People are very scared of the word dialysis for two reasons. One is a lot of misinformation about the dialysis. Second is people are not aware dialysis technology has changed over the years. Dialysis is not a hindrance to your life. It allows you to continue living. Now, amongst all the organs in the body, we don't have artificial brain.
Yes.
We don't have artificial liver. We don't have artificial intestine, eye. The only organ where we have an artificial kidney is the kidney renal system. And the dialysis machine is an artificial kidney. What your kidneys can't do, it does it for you. So, if you don't do dialysis, you will not live. Dialysis today allows you to live for 15, 20, 30, 35 years with normal function. I have patients who go on cruise, they travel the world. The dialysis technology has changed so much that today dialysis is painless, stress-free, and gives very long and good quality of life. Whatever is available anywhere in the world as a dialysis technology is available in India. It's no longer that we have to go to the West. In fact, we have people flying in from the West to get treatment here. The latest form of dialysis technology, high flux dialysis, middle flux dialysis, high cutoff dialyzers, hemodiafiltration, CRRT, CVVHD, everything is available in India across the country. It's not even that you have to travel only to Delhi and Bombay to get that kind of therapy. We have phenomenal quality of dialysis. The same equipment which you will find in Germany, in Australia, in US, in Canada is the same equipment which is being used in Indian dialysis centers. So we are actually giving state-of-the-art therapy at a fraction of the cost. One dialysis session in the United States costs $1,000. That is almost 80,000 rupees. In India, in the best of centers, is just 4,000 or 5,000 rupees.
So recently, the government of Arunachal Pradesh has recently introduced kidney transplant facilities at dreams. How do you see this step benefiting patients in the state, and what further support is needed? I mean,
see, a kidney transplant is the ultimate form of therapy in kidney disease. The moment you get a kidney transplant, you're off dialysis. You go back to as a productive member of the community. You can go back to work. You can support your family. You can continue your education. So it's a very, very important step.
Okay.
And establishing a kidney transplant center within the state is a very important process, because at least basic limited forms of transplant definitely can be there. Complicated transplant, second transplant, of course, they'll need to go to higher centers in major cities, but at least the basic infrastructure and the availability of higher modes of therapy will definitely benefit the population.
So last question is, what message would you like to give specifically to the people of Arunachal Pradesh about protecting their heart and kidney health?
First is awareness. If you're aware that you may be getting these diseases earlier, you no longer get these diseases at 60 or 70. Now you start getting these diseases at 30 years of age.
Yes.
And the awareness of a healthy lifestyle. You see, it's much easier to go and eat a burger or a pizza than to cook healthy food. It's much easier to play a video game and then go and play badminton or squash. Avoidance of sedentary lifestyles. So awareness is first. When you're aware of what you need to do, you will get yourself evaluated in time, you'll get yourself tested in time, and you'll get yourself treated in time. If you get yourself treated in time, There is no irreversible damage to your organs. And the earlier you treat, the more organ you benefit. It's like you don't wait for your entire house to collapse from seepage. You try to treat the seepage at the earliest and you look for it. So the kind of effort you put into your possessions, put it for your own body.
So as we are talking about, awareness is one of the most important things, and the second is treatment at the right time for the right person. It is very, very important, because sometimes patients have diseases inside and they are not getting it treated. They are delaying the treatment. So delaying treatment is denying treatment. So we should not deny our important organs of the body from early treatment, because if we don't treat in time, the organs will get damaged. They will become weak. If somebody has, for example, already developed a heart attack, even if I do angioplasty, the heart will not be so healthy. But if I do the angioplasty before the heart attack has happened, his heart will be absolutely normal. So early diagnosis, early detection, and early treatment is the key to success.
Thank you, sir.